Hi, my name is Becky Lynn and I'm one of the post-liver transplant coordinators. I will be guiding you through this presentation on life after a liver transplant surgery. This presentation will let you know what to expect after being discharged from the hospital. As you begin your post-liver transplant journey, taking care of your new liver is essential to a successful transplant. First thing to understand is your medications and the dose and times you take them. You will also get routine blood work and have follow-up clinic appointments with your liver transplant team. You need to be an active participator in all self-care activities. Communication with your team, including your hepatologists, nurse coordinators, and nutritionists, is vital. Your lifestyle may change to incorporate a healthy diet and exercise to achieve optimal levels of wellness. It is also important to remember that the liver transplant program is a team of which you, the patient, are the primary member. Here's our overview for what topics we'll discuss. First, we're going to cover contact information for your transplant team, and then lab work and what that includes, medication and potential side effects that you may or may not experience, nutrition guidelines and recommendations, self-care activities, clinic and lab instructions, as well as the checklist to bring with you, and then we will conclude with some things to remember. Contact information for the Stanford Liver Transplant team. Our office number is 650-498-7878. Our office hours are 8:30 in the morning to 4:30 p.m. We are closed on weekends and on holidays. In the event of a need during those times, please call the operator at 650-723-6661 and ask for the hepatologist on call. They should help you with any need at that time. Please note that the numbers for your hepatologist, your coordinator, and your social worker are left blank. That is because they will be filled out for you individually prior to discharge at the hospital in your discharge binder that will also be provided for you. Post-transplant labs and what they include. When you are admitted in the hospital after surgery, you get labs drawn once every day. After your discharge, you will get labs drawn twice per week, usually on Mondays and Thursdays. This slide groups some of the specific labs that you will get. The first group is a coagulation panel, which includes a PT and a PTT. These two labs measure your liver's ability to create clotting factors. The next group of labs is called a hepatic panel. They include both bilirubin and albumin, an AST, an ALT, an alkaline phosphatase, and a GGT. These all help us understand the way that your liver is working and functioning, and help us understand if we need to make any adjustments to your medications. These are the last three categories that your routine blood work will include, the first of which is your basic metabolic panel, which includes electrolytes such as phosphate, magnesium, sodium, and potassium. The next category is your CBC, also called complete blood count. These tests are your white blood count, your platelets, and your hematocrit levels. And then the last third category is your immunosuppressant drug level. This lets us know what the drug level is at the time of blood draw and helps us adjust your immunosuppressant medications as needed. After your transplant surgery, you will need medications to prevent the rejection of your new liver. These medications start immediately after your surgery, and they are called immunosuppressants. You will take them every day and at the same time. This is crucial in order to prevent rejection of your new liver. They are usually taken for a lifetime duration. Some of the medications you took prior to your transplant, you will continue taking post your transplant. You will also take medications to help with the prevention of any side effects. Please consult your liver transplant team if you have any questions or any new medications. Only take prescriptions from a doctor who is aware you have had a liver transplant, and confirm with your hepatologist prior to taking. Your immune system rejects anything foreign in your body, so it must be suppressed to prevent your body from rejecting your new liver. You will need to take the medications or your immunosuppressants exactly as prescribed. The doses that you take are important to maintain, and you will take them for a lifetime duration. Medications have two names, generic and brand. Both of the names refer to the same medication. Some medical professionals will use different names, both the brand and the generic. It's important to remember that they do refer to the same medication. An example of this is tacrolimus is a common immunosuppressant. Tacrolimus is the generic name, whereas Prograf is the brand name. You will hear your doctors refer to them as both. Here is a list of commonly prescribed immunosuppressant medications. You can see their names as prednisone, tacrolimus, sirolimus, cyclosporin, and mycophenolate. Their mechanisms of actions are also provided there on this chart. If you would like to learn more about how these different medications work, you can read this and review this slide below. Sometimes there are unpleasant reactions to your anti-rejection medications. Some of the other medications you are on can also cause side effects. In the next slide, we will discuss the potential side effects you may or may not experience and how our team will help you manage them. Here are the list of possible complications for being on anti-rejection medication. To highlight a few, bone disease, diarrhea, high blood pressure, increase in weight, high blood sugar, kidney damage, and sensitivity to the sun, which could lead to possible skin cancer. In the next couple of slides, we will go into more depth. As we mentioned earlier, to prevent rejection of your new liver, you will need to take immunosuppressant medication, which lowers your immune system. This in turn means that you are now more susceptible to acquiring infections, such as viruses. This slide is a list of antiviral medications that you may or may not take after your transplant surgery. The same way that you might be taking antiviral medications due to your lowered immune system, you may also be taking antifungal medications. The most common on this list is nystatin, which is an oral suspension, and you swish it in your mouth and then you swallow it. This helps prevent both oral and throat yeast infections. Here is our final slide of medications. These may be the medications you take to treat side effects of your immunosuppressants. You will notice on this list antihypertensive medications which do treat high blood pressure, as well as antidiuretics such as Lasix. This is to get the excess fluid that you may retain in your body. And then if you took Ursidile prior to your transplant, there's a good chance that you may take it after your transplant as well. These are all at the discretion of your hepatologist and liver transplant team and will be discussed in your in-clinic visits. Even when taking immunosuppressant medications, your body can still reject your new liver. It is important to know what the signs and symptoms of rejection can look like. This slide gives a few examples. To highlight, a fever of 100 or greater, please tell your transplant team immediately. Also, abdominal pain, tenderness at the incision site, an increase in your abdominal size, which could look like swelling, flu-like symptoms or dark urine, and light-colored stools, all of which could be signs of rejection. And please keep in mind to communicate with your transplant team immediately. Unfortunately, rejection does not always have signs or symptoms present before the episode. This is why it is so important to get your blood work done timely. That way we can see from your liver function tests how well your new liver is functioning and if there are any signs in your blood work of rejection. If you have any concerns about the results of your blood work, you can always call our office, 650-498-7878. You can also reach out to one of the post-liver transplant coordinators via your MyHealth app. One common question we often get after our patients have gotten their liver transplant is what to do in the case that you test positive for COVID-19. First and foremost, please do let your transplant team know in the case that you test positive, but also follow up with your primary care physician. This slide gives several resources with what to do about COVID, including CDC official websites. Another complication that can occur post-transplant is high blood pressure or hypertension. This is defined as your top number, your systolic number, being greater than 140, and your bottom number or your diastolic number being greater than 90. High blood pressure can cause heart disease and lead to strokes. This is why it is so important to both monitor and control. In your discharge binder provided to you during your initial hospital stay, there is a vital sign log at the back. Please take your vital signs twice daily and bring this log with you when you come to your clinic appointments with your hepatologist. The same way you can develop high blood pressure from your immunosuppressant medications, you can also develop high blood sugar or diabetes. The risk to having continued high blood sugars are wound infections, dehydration, kidney, and heart disease. The initial treatment is diet and exercise modifications, but if these are not effective, you will need to begin taking medication to control. Long-term diabetes management is directed by your primary care doctor as well as a nutritionist. They will support you as you seek to keep your blood sugars levels controlled. A long-term complication some transplant recipients face is the development of high cholesterol levels, or hyperlipidemia. High pre-transplant cholesterol levels, diabetes, high-fat diet, obesity, age, and anti-rejection therapy can all contribute to developing post-transplant hyperlipidemia. Hyperlipidemia can cause the hardening of your arteries, which is why it is so important to maintain a healthy lifestyle with diet and exercise. Your hepatologist may also recommend beginning a cholesterol-lowering medication. Anxiety and depression are also potential post-transplant complications. The long-awaited event of receiving your new liver does not always bring the anticipated exhilaration. You may be experiencing pain related to your surgery, medication-related mood swings, family and/or financial stresses, which can all contribute to anxiety and depression. There are many resources, however, including liver support groups, so please reach out to your social worker or nurse coordinator for more information. Your immunosuppressants make you at a greater risk for developing cancer, including skin cancer. You will need routine cancer screening procedures, including yearly mammograms, pap smears, stool samples, and exams for the skin, testicular, and prostate cancer. Pay a special attention to the development of sun marks or moles, especially for increases in size. Due to increased sun sensitivity caused by your immunosuppressant medications, you must always wear a hat and sunscreen when in the direct sun. While you are still in the hospital after your transplant surgery, you will meet with our nutritionist team for education on maintaining a healthy diet. The dietitian team will support you throughout your recovery journey and continue to give detailed recommendations and resources. Self-care after transplant, bathing and showers. Showers can be taken after the last JP drain has been removed and the biocatheter has been clamped. This is usually 6 to 7 days after your surgery. If you still have a biocatheter at discharge, be sure to protect it. You will want to remove the dressing that covers the catheter before showering, tape the tube to your body to prevent it from becoming dislodged accidentally. Lightly soak the area and rinse. After washing, gently pat the incision and catheter area dry. Sitting in bathtubs, saunas, jacuzzis, and swimming pools are not recommended until the catheter has been removed and your incision is completely healed. After discharge, it is necessary for you to continue to monitor your vital signs, including blood pressure, weight, and temperature. I mentioned earlier that you will be provided a vital sign log to bring with you to your clinic appointments. The first log will be done when you first wake up in the morning before eating or drinking, and the second log will be in the evenings, usually before sleep. Please remember to bring your vital sign log with you to your transplant clinic visits to review with your hepatologist. Physical activity plays an important part in your recovery. You will have less energy and be tired when you initially return home from the hospital. Continue the exercises that you learned in the hospital and go outside for walks as you are able. Avoid lifting more than 10 pounds for the first 3 months after your surgery. Also avoid excessive strain from pushing or pulling large objects such as furniture. It is recommended that you do not drive for several weeks after your surgery. Check with your hepatologist for when it is safe again to drive. Most patients can return to work 2 to 3 months after your surgery. However, this will depend upon the type of work you do. Our social worker team can assist you in finding a vocation rehab facility for possible retraining if necessary. Sexual activity may be resumed as soon as you are feeling up to it. Anal intercourse is not recommended due to the effects of prednisone on rectal tissue. The use of a lubricant, such as the KY jelly, may help relieve any degree of vaginal discomfort or dryness. Premenopausal women will usually begin menstruating a few months after liver transplant. If you are taking prednisone, please note that menstrual bleeding can stop, but the ovulation can still occur, meaning pregnancy can occur even if a monthly period does not. There are several acceptable methods of birth control, and your gynecologist and hepatologist can provide more info on birth control options. Female transplant patients who wish to have children should thoroughly discuss the matter with their transplant physicians first. Pregnancy can create difficulties and should not be considered for at least 1 year after surgery. All anti-rejection medicines must be taken throughout pregnancy to prevent rejection. There is still little known about the effects of Prograf on a developing fetus. Women should continue to have yearly pap smears and gynecological exams. Always practice safe sex. Here are some miscellaneous do's and don'ts after a liver transplant. First, never consume alcohol after transplant. You will be randomly tested for alcohol levels in your blood and urine as routine post-care. Second, you may experience overgrowth of hair. For treatment options, feel free to reach out to your transplant team. Third, as we already mentioned, immunosuppressant medications increase your sensitivity to the sun, so you should always use sunscreen and wear a hat when in direct sun. Last, vaccines, including flu and COVID vaccines, are recommended at the discretion of your primary doctor. However, you should never receive a live vaccine, such as the polio or MMR vaccines. All of your post-transplant clinic appointments are scheduled by calling the liver transplant office. The initial phase of post-transplant will require blood drawn bi-weekly on Mondays and Thursday mornings at the Stanford Healthcare Lab. Eventually, you may be approved to continue your lab work at either a Quest or LabCorp location. It is extremely important to remember that the morning of your blood draw, do not take your immunosuppressant medication until after the draw. This is a clinic checklist for you to refer to in order to know what to bring with you to your clinic appointments. Some final things to remember. Liver transplant coordinators are available Monday through Friday from 8:30 in the morning to 4:30 in the afternoon. They assist with any questions, reordering of medications, reviewing of lab results, and addressing any other of your medical concerns. After 4:30 p.m. and on weekends and holidays, liver transplant hepatologists are on call for emergencies only. Please do not call for prescription refills or other questions that can be answered during regular business hours. The on-call hepatologist can be reached by calling 650-723-6661. This is the Stanford Hospital operator number, so you will need to ask to speak to the on-call hepatologist. Do not start any new medications without confirming with your transplant team first. And also do not take medications or supplements unless your primary doctor or hepatologist approves them for you. Some things to keep in mind regarding vacationing. Due to infection and rejection risk, it is not recommended to travel out of the state for the first 6 months after transplant without first checking with your hepatologist. Be sure to bring adequate and extra medication with you when you do travel. And remember to ask your primary doctor about obtaining vaccines prior to traveling to a foreign country. Prescription refills. You should always maintain a minimum of 1 week supply of your immunosuppressant medications and all of your medications. When your supply is down, it is your responsibility to notify your pharmacy to get your refills. If your pharmacy requires your coordinator to place the refill for 1 year supply, you can then reach out to your coordinator. If a new prescription refill is needed, the appropriate time to obtain these is during your clinic appointment or during regular office hours. Please do not call during non-office hours or weekends for prescription refills. Thank you for watching this video on life after a liver transplant. This PowerPoint presentation and video are meant to be a summary of your discharge binder and are not all inclusive. Please refer to your discharge binder for any additional information. And finally, congratulations on your successful organ transplant. This is a remarkable milestone in your journey toward improved health, and we are here to support you as you both recover and embrace this new chapter in your life.